Hi, I'm Matt Pianko. I'm a hematologist at the University of Michigan in Ann Arbor, Michigan, and I'd like to talk to you today about the MASTER trial. So the MASTER trial is a trial conducted and led by Luciano Costa at the University of Alabama, Birmingham, and was looking at the evaluation of a four-drug regimen, daratumumab, carfilzomib, lenalidomide, and dexamethasone for newly diagnosed multiple myeloma patients. So what the MASTER trial is seeking to do is to use dara-KRD induction as treatment for patients with newly diagnosed myeloma in combination with a stem cell transplant, and sequentially to give 4 cycles of this regimen and evaluate to see if the myeloma could be eliminated and assessed using a test called minimal residual disease. This is a bone marrow-based test to look for tiny trace amounts of myeloma. And what we've found is that patients potentially who reach an MRD negative state, or a place where there isn't detectable myeloma left over in the bone marrow using these sensitive tests, we find that these patients historically in clinical trials have done very well. So what Dr. Casas sought to do is to create this study to look to see if we gave this intensive treatment regimen for patients up front, and we got patients to a place where their myeloma could no longer be detected in the bone marrow, could, after that point, we observe patients and instead of having patients perpetually on maintenance therapy, could there be periods in which a patient could get to a deep remission from their myeloma but then be observed? So this trial was recently carried out, and it's going to be reported at this meeting. Interestingly, what we found were pretty high rates of complete response, high rates of MRD negativity. And as we got further and further out, meaning patients got their 4 cycles of dara-KRD and their transplant up front, then they got an MRD test. If they were positive, then they got 4 more of dara-KRD. And then sequentially had MRD tests after each segment of adding 4 more cycles. And we found that more and more patients got to MRD negative state, and really found that a pretty small percentage of patients were still MRD positive after having gone through all this. I think that this trial is a unique way of trying to treat myeloma patients, and that perhaps using intensive therapy up front and then offering a period of observation could be a viable way to treat multiple myeloma.